Hello and welcome to the Back to Health Chiropractic New Patient Orientation. Most people think that an adjustment is the most important thing that we do in our office, but it is absolutely not. This orientation is the most important part of your entire care, which is why we have every new patient view it before they start. Yes, there will be several things that I'll discuss with you today, including the science of chiropractic, how chiropractic works, why it works. We'll also discuss when to go to a chiropractor and when not to go to a chiropractor. I'm going to make my first apology of the class, and the first apology is that in addition to chiropractic school, I also went to seminary school. So in our office, sometimes the things that we do are perhaps a little politically incorrect, but I think you'll get a hold of it. One thing I'd never ever want to hear you say in my office is that I believe in chiropractic, because chiropractic is not a religion, it's a science. I don't want you to believe chiropractic, I want you to understand it. And during this class, I'm going to actually teach you all about chiropractic, and I hope that you'll understand it at the end. In order to understand chiropractic, you have to understand a little bit about the nervous system. In order to understand the nervous system, we need to know what controls and coordinates all the functions of the body. And of course, that's your brain. The brain is connected to all 70 trillion cells in your body. If there's an interference in messages produced by the brain and sent to the body, that part of the body won't function well. Don't think of the brain just like a brain anymore. I want you to think of it more like an electrical generator. It generates electrical impulses that are sent to each part of the body, and the body sends an electrical impulse back to the brain so that they can communicate and the brain can keep that body part healthy. The only thing that a chiropractor does is removes the interference between the brain and the body. That's our only purpose. So the only thing that I'll be doing with you is looking at your spine for misalignments called subluxations that interfere with that message. So let's talk a little bit about the different parts of the spine that I'll be checking when you're in the office. This is a spine. There are three parts of the spine. There's the cervical, the neck, the thoracic or the middle back, and the lumbar spine. It's a sheet of armor that actually protects your central nervous system. The components of this sheet of armor are these individual bones. These bones are called vertebrae. They're separated by shock absorbers, these clear things, which are called discs. Inside your spine, there's a cord that runs from the base of the brain all the way down to the sacrum. Inside the spine, there's that clear plastic cord, which represents your spinal cord. Off of the spinal cord runs 27 pairs of nerves. These nerves go out and supply all 70 trillion cells in your body. That's it. That's the only part, all the parts of the spine that you'll need to know when you come to our office. There is, however, one big word that I'll ask you to memorize in our office. It's a subluxation. We know it more detailed as a vertebral subluxation. Subluxation is broken down into three parts, that word, so you understand it better. Sub means less than or below. Lux is light or life. And ation is the condition of. So it's a condition in your body when the brain's not sending all the electrical impulses that it should, and as a result, that part of the body begins to get sick or diseased. So the only thing that a chiropractor can do is called detecting and correcting a vertebral subluxation. It is the only thing that we do in our office, is detect and correct vertebral subluxations, period. So let me show you what a vertebral subluxation looks like. All the bones of your spine should line up perfectly straight. And if you run your fingers down the spine, it's what's called palpation. We're actually feeling the spine. If those bones don't line up properly, let's say at T1, 2, 3, this is T3, the nerve that goes to your lungs. The bone goes out of its normal position, and the nerve is pinched on the opposite side. Muscles actually tighten as a result of stress, pull the bone out of place, and pinch the nerve. Wherever that nerve goes to won't function properly. Since this is T3, the lungs begin to not function properly. So let's say you were the chiropractor, and I go to your office, and I tell you, Doc, I have a lung problem. I'm having trouble breathing. Well, as a chiropractor, since the only thing you can do is detect and correct subluxations, you'd probably tell me, well, I don't know much about that lung problem, but I can feel there's a misalignment in your spine, just at the top of the shoulders, T3. It happens to be the nerve that goes to your lungs. What you would do for me is take the bone that's out of alignment and put it back into alignment, taking the pressure off the nerve, so the brain can now fully communicate with the lungs again. 2 days later, I might come back to your office and say, you fixed my lungs. And that wouldn't be true at all, would it? All you did was detect and correct a vertebral subluxation. That's it. The body healed itself. So never give a chiropractor any credit if you feel better after an adjustment. You see, the truth is we can't treat pain or any named disease in the body. All we do is remove the interference, remove the subluxation. We call that an adjustment when we move the bone off the nerve, to allow the brain to communicate and the body to heal itself. It can happen in any part of the body. In the lumbar spine or in the lower back, the muscles get tight, and as the muscles get tight, there's a subluxation in the lumbar spine. This happens to be L1, where that nerve is being pinched. And that nerve goes to the large intestines. As we put that bone back into place, lots of people report that their digestive system is better. But we didn't actually take care of their digestive system. All we did was detect and correct the subluxation in their lower back. Period. The neck is a little different. In the neck, there are two red things running right through the bones of the neck. Not around them, but through them. These are the vertebral arteries. They supply all the blood to the top to the head. If there's a subluxation in the neck, the bones go out of position, and it actually occludes or pinches the artery on one side that goes to the head. God did you a favor and made only one of those arteries pinch, not both, when the head is rotated. If, when you rotated your head, both arteries got occluded, you'd actually pass out. So when we put the bone back in line in your neck, if we take that subluxation and correct it with an adjustment, it opens the artery in the neck and allows an increase in blood flow. That's why sometimes after you're adjusted, you might feel a little bit lightheaded for 5 or 10 seconds. It's just your body getting used to that increase in blood flow to the head. This is important for adults, but it's more important for children. Because in 1984, there was a study done by a Dr. Tobin and a Dr. Gutman, where they actually studied babies that had died of sudden infant death. What they found was, during the birthing process, the head comes out first. In order to get the shoulders, the neck is rotated. When the neck is rotated, the second bone in the neck often goes out of its normal position. When that happens, it occludes one of the arteries. So only one artery is occluded during the birthing process, possibly. But before 1984, when they did their study, mothers and parents were taught to put their babies to sleep face down. The baby couldn't stay face down, so it had to turn the head in order to get air. And when that happened, there was a second subluxation. Medical doctors call these vertebral motor unit disrelationships. Now, you already know those words. Vertebra, vertebral, motor unit, that means two of them. Disrelationship, where they're not lined up. That's another way to say a vertebral subluxation. So if we have a subluxation to the right, occluding the left artery, and a subluxation to the right, to the left, occluding the right artery. Now both arteries occluded, and what they determined was those babies died of hypoxia. Hypoxia, or a lack of blood flow to the head, was the main reason for a sudden infant death. After that study, we realized that we should probably put a baby to sleep on their back, not on their stomach, to avoid that rotation. Now, what makes more sense than just changing the way we put a baby to sleep? What about at birth? We have a chiropractor come into the delivery room and check the baby to find out if there's a subluxation. If there is a subluxation, that chiropractor could gently, with just the pressure, if you put it over the top of your eye and push into your eye with your eyelid closed, that's all the pressure we use, put that bone back into position and take the pressure off that nerve and the arteries, so the brain is able to fully communicate with the body, but it also opens up the artery so the vertebral arteries are functioning properly. Why doesn't every new parent demand that a chiropractor is present to check their child? About half the children I check are out of alignment. Why doesn't every new parent demand that there's a chiropractor there to check their child? And I'll tell you why. Because every new parent thought the same thing as you did before we started the class, which was that chiropractic was not to correct a subluxation. They didn't know about that. They just thought it was to treat pain. We don't do that at all. Their baby comes out, and they say, my baby looks fine. My baby doesn't hurt. Don't touch my baby. When in fact, chiropractic's not to treat pain. It's just to detect and correct subluxations to allow the body to function properly again. So get this out of your mind that chiropractic's for pain. Chiropractic is to remove subluxations to allow the body to function properly. Period. So, as I warned you, I did graduate from seminary school. So I'm going to teach you a little more about the nervous system using sort of a parable of the light bulb. So we're going to use this light bulb and this cord as just a parable for how your nervous system works. This electrical outlet on the wall produces electricity, just like your brain does. This cord going from the electrical outlet to this dimmer is just like a cord in your body called the spinal cord. This dimmer is just like two bones in your spine. If the bones are in line, all the electricity from that outlet, all the electricity from your brain, will get to this bulb. If the dimmer is turned all the way down, no electricity will be able to get through, just like a bad subluxation would cause. So if there's no subluxations in this dimmer at all, and the brain is able to fully send all the electrical impulses to this bulb, which is going to be represented by, this bulb is going to represent your stomach. It's going to represent the T6 vertebra. T6, the gastric nerve, goes to your stomach. Now, at home, you can imagine this bulb being your neck. You can imagine it being your lower back, any part of the body that you might go to a chiropractor for. This is just going to represent that. So if there are no subluxations in this dimmer and the brain is able to fully send all the electrical impulses to this bulb, it will be a very, very bright light bulb. A very bright light bulb indeed. I won't blind you with it. Let's pinch the nerve just 10%. Just pinch the nerve just a little bit, so the bone will go out of line just a little bit. 10%. This person now, I'm going to turn the dimmer down 10%. And you can see it didn't go down very much. You can still light the whole room. This person is now 90% healthy. They're only 10% diseased, we call it. Not diseased, diseased, not at a state of ease anymore. They feel 90% healthy. They feel great. Let's pinch the nerve a little bit more. We're going to put about 5 millimeters of pressure on that nerve. Again, they feel great. Now we're going to put just over 5 millimeters of pressure on the nerve. We're going to pinch the nerve so that it crosses the pain threshold. Now you begin to feel that pressure on the nerve. And the bulb begins to start changing visibly. 30% of the pressure is on that nerve. You begin to start belching. And you begin, this is where we make excuses. My back hurts. Oh, it was nothing. It'll go away. Belching. it was just the soda I drank for lunch. It couldn't possibly be my gastric nerve. Couldn't possibly be T6 getting pinched. Let's pinch the nerve a little further. Bloating. Bloating. I must have eaten something for lunch. It had too much salt in there. I'm bloating. Can't possibly be that pinched nerve. 50%. Look what's happening to your body. Nausea. Nausea. Oh, we're taught what to do for this, aren't we? We learned this on TV, right? Belching, bloating, indigestion. Belching, bloating, indigestion. Belching, bloating, indigestion. You just must need some Pepto-Bismol, right? To hide the symptoms instead of taking care of the cause. You see, up until here, it's okay to see a chiropractor. After this, the problem's gone on too long. Low back pain, okay, you can see the chiropractor. After it gets too bad and you can't get on my table, I can no longer see you alone as a chiropractor in my office. Now we have to call in for other help. So you have to know when you have a problem that's not a chiropractic problem too. 60%. Heartburn. Heartburn is heartburn. Ask any cardiologist and they'll tell you when the digestive system shuts down. The next system that shuts down is the cardiovascular system. It's gone past what a chiropractor can treat on their own. Certainly you should be checked and adjusted for any subluxation, but now you've got a problem that needs to be seen by a medical doctor. Bleeding. Sure, this is the time to go to a chiropractor, right? Black, tarry stools. No, it's not the time to go to the chiropractor. You need a medical doctor now. You waited too long. Sure, you can be adjusted, but if you bleed for a long enough period of time, what's going to begin to happen? Dizziness. And people come into my office all the time, and they're dim light bulbs. They waited too long. The problem is too severe. And if you have more than 12 millimeters of pressure, 80% of that nerve is pinched. For more than 6 months, it creates a condition called permanent nerve, you know what the term is, permanent nerve damage. And anywhere where that nerve goes to, what will happen to those cells at the other end of that nerve? They die. This is not a hard concept. This is a great analogy for how the nervous system works. So don't look at a chiropractor anymore as some construction worker trying to pop and crack your bones back into position. We're more like electricians. Our job is to find when you're a dim light bulb, take the pressure off the nerve by adjusting and getting rid of the subluxation so that you can once again be a bright light bulb. That's the goal of a chiropractor. So how do we find these subluxations? Everybody, oh, it's amazing you found right where the problem is. Well, it's not that amazing. You could do it very easily too, through palpation. We just feel the spine to find out where the misalignments are. Range of motion. Have you ever seen somebody that had their driving down the road and they were able to turn their head to the left, but when they turned their head to the right, they had to turn their whole body? If your spine is out of its normal alignment, it ruins your range of motion. You're not able to, you can't turn properly anymore. We see it in your posture where your head is tilted and the shoulders are high and the hips are high. We can also see it on what's called a thermal scan. A thermal scan is a special test that we do in our office. It's a $10,000 thermometer that actually measures the temperature next to your spine. When a muscle gets tight, it gets warm, and I can see where the muscle's tight. If there's inflammation or swelling, I can also see where that inflammation and swelling is. It'll tell us which way the bone is being pulled, and I'll automatically know that the nerve is being pinched on the other side. Some chiropractors use x-rays, and we do too when a problem is not responding or if it's a severe problem, but we do not x-ray everybody on the first visit. We use that infrared thermal scanner as our first line of finding out where that subluxation is. Our first line of technology with no side effects and no radiation. When you come into my office, you might notice that you'll tell me about your sore neck and your stiff back, and you may notice I'm not paying very close attention to all the symptoms that you're telling me about. There's only one reason that I even look at the symptoms that you talk about, and that's to determine whether you're a chiropractic patient or if you've let the problem go so long and it's so bad that I need to actually share you and send you out for a second opinion with a medical doctor. ordinarily we'll be able to adjust you. But our goal is not to get rid of any of those symptoms. We can't do that. Our only goal is to detect and correct the subluxations, to restore the communication from your brain to your body, so your innate ability, your inborn ability is able to heal your body. We as chiropractors don't take credit for getting you well. All we do is remove the interference so your body can heal itself just like it was designed to do. Everybody always asks, "You just adjusted me. How come I'm out of alignment again?" Well, the answer is stress. Stress is what causes the muscle to get tight and pull the bone out of place. Stress comes in 3 flavors: vanilla, chocolate, and strawberry. No, it comes in mental, physical, and chemical. All 3 types of stress have the same effects on your body. Mental stress pretty typically affects the neck and shoulders. When you're mentally stressed, the muscles get tight and pulls the bones in your neck out of alignment. If you're walking around like this stressed, that tightens a muscle called the trapezius muscle. The trapezius muscle connects your shoulder to the base of your skull. When those muscles pull the first bone in your neck out of alignment, that first bone, C1, that first nerve, goes and supplies the muscle, your head. The bones of your face, your scalp, the pituitary gland, the blood flow to your head. And people that have mental stress and that C1 is out of line, what do they come in complaining of? They come in complaining of headaches. And I don't touch their head. All we do is we correct the first bone in their neck. That's it. And when we put the first bone in the neck in line, most of the time they say, "You fixed my headache." And now you know that's not true. All I did was correct the subluxation at C1, but their headache is gone, isn't it? The second type of stress is physical stress. Bending, lifting, and twisting. Bending, lifting, and twisting often affect the lumbar spine or the lower back. So if you have chronic lower back problems, you're probably not bending, lifting, or twisting properly. Chemical stress is one everybody forgets about. Everybody likes to forget about it because that's allergies, viruses, bacteria, alcohol, smoking, eating bad food, or not having proper water supply. All those chemical stresses affect your organs, and your organs communicate with your brain through the thoracic spine, the middle back. So if you have chronic middle back problems that keep coming back after an adjustment, we need to find out what chemical stress is affecting you to stop your subluxations from returning so often. So those 3 types of stress are really what causes subluxations in the body. If you forget everything else about this class, this is the slide that I would like you to remember most. This will teach you how to keep you and your family healthy. You see, stress causes muscles to get tight. Tight muscles pull the spine out of alignment, and that's called a vertebral, say it at home, you're right, subluxation. A vertebral subluxation. If you've had a subluxation, you know that's no fun. That causes more stress because it's uncomfortable most of the time. And a subluxation means the nerve is pinched, so it's sending too much message to the muscle, which causes the muscle to get in spasm and causes more subluxation. When you have a subluxation for a long enough period of time, it's not just back pain, you begin not to move properly. We call that a dysfunction. If you dysfunction for a long enough period of time, you get to go to your medical doctor, and they name it for you. It's no longer back pain. Now it's lumbosacral radiculopathy secondary to stenosis. Oh, you have a bunch of Latin names for it now. Made you feel better, didn't you? No. All that did was made you more stressed. And people are caught on this hamster wheel. So let's get off the hamster wheel for us and our family. Let's break the cycle. The most cost-effective, and sane way to break the cycle is to stop stress from causing a muscle spasm. There are 2 good ways to do that. The first way is exercise. Research shows it only takes 15 minutes a day of exercise in order to reduce the effects of stress on the muscles. The second way is meditation. Or if you went to seminary school, you're allowed to sit quietly for 10 minutes and pray. While you're sitting there right now, just take one big deep breath and breathe all the way out. And again, take another deep breath and breathe all the way out. Do it with me. One more breath. And lower your shoulders and relax. Just sitting, meditating, or praying for 10 minutes can reduce the effects of stress on the muscles. And you know what people tell me? I don't have 10 minutes to exercise and 15 minutes to exercise and 10 minutes to sit quietly. So you wind up with muscle spasm. Who in our community is uniquely qualified to break the cycle right here between muscle spasm and subluxation? A massage therapist. It's all they do all day long. How often should you see a massage therapist? Well, research says every 7 to 10 days. Everybody tells me, I don't have $70 every 7 to 10 days plus a tip. So they wind up with so much muscle tightness that it pulls their spine out of alignment. And they wind up with a subluxation. Now who do you have to see? You're right, your friendly neighborhood chiropractor. We break the cycle in 2 places. We break the cycle here at the top when a subluxation first starts, before there's a symptom, to keep you healthy. That's the preventative way to go to a chiropractor. Or, once you're already hurting, we have to break the cycle here to start the body functioning again, so the brain can communicate again with those body parts. Chiropractic is prevention, and unfortunately, sometimes we need to get the body moving properly again too. But that's not really our job. How often should you see a chiropractor? Well, the research shows every 7 to 10 days. And people say, I'm not going to that crazy chiropractor. He wants to see every 7 to 10 days. So they wind up hurting so bad. They're not moving properly. They can't move anymore. So who in our community is uniquely qualified to break the cycle here if you hadn't gone to the chiropractor? That's a physical therapist or an occupational therapist. Their job is to get the body moving again and to strengthen and stabilize. Often we have to work with these PTs and OTs to help the body to function properly again. But people tell me, I can't go to the PT, that's $75, and they want to see you 3 times a week. So they wait and wait and wait, hoping, crossing their fingers that a subluxation will go away. And you know that crossing your fingers won't take away a subluxation. So they get so bad and they hurt so bad they can't even get on my table. At that point, who do they need to see? They need to see the medical doctor or a surgeon for medicine or surgery. They waited too long. That's who breaks the cycle way up here. And it's too late at that point, most of the time, to see a chiropractor. You'll notice that this cycle is broken up into 2 parts. The top part is prevention, and the bottom is treatment. Which one makes more sense? Preventing a problem or treating a problem? It's not really a discussion, is it? It's a decision. And I hope you make the decision to prevent it. But don't pass judgment on people that have been brainwashed by TV and all these medical ads. If they decide to use the medical route, my suggestion is just for you and your family to focus more on prevention. What's this once-a-week business? You're talking about once a week. Well, the research was done by Dr. Wiedemann in 1987. He took rabbits and he bound up their knee joint. They subluxated the knee joint, stopped it from moving. After a day, he took the binding off and he looked inside, and the knee joint looked fine. After 2 days, it looked fine. But after 3 days of subluxating the knee, keeping the joint from moving, which is exactly what happens in your spine when the bone is out of line, not in motion, subluxated, he found a little bit of scar tissue forming. After 7 days, he found a lot of scar tissue forming in the joint. But after 14 days, after 2 weeks, he found there were the first signs of eburnation in the subchondral bone. That is, exposure, wearing, and hardening of the bone because of breaking down of the protective layers in the joint. If you've had an x-ray, this might sound familiar if you've waited a long time with a subluxation. He found 3 things happened. The joint space got smaller, spurs started to form, and calcium started to form in the joint as well. Those 3 things combined, joint space smaller, spurring, and calcium formation, are called arthritis. So by keeping the joint in motion, by keeping the spine adjusted weekly, preventatively, we avoid that breakdown of the joint. So in addition to restoring communication between the brain and the body, the second reason for an adjustment is to help avoid arthritis. Now, Dr. Wiedemann changed medicine at the same time. Because after 1987, when someone had knee surgery, they immediately were told to get out of bed and start walking to get the joint moving again. Because they knew that if they can see the arthritis after 2 weeks, they could actually, the arthritis began microscopically after just minutes. The same way in chiropractic, we don't want to allow a subluxation to be there until there's a symptom and a problem. We want to correct that joint and adjust it before there's a problem. Everybody wants a prescription for health. Everybody loves a prescription. So I'm going to give you a prescription for your health. It used to be composed of 4 things, but I'm adding a 5th. If you want to be healthy, just being adjusted alone is not going to do it. An adjustment will remove the interference in your nervous system so your body can fully express life and heal as fast as possible. But the truth is you have to do some other things in order to stay healthy. You need to eat well, move well, think well, stay well adjusted, and sleep well. Now, I'm only an expert in keeping your spine well adjusted. I can have you come in once every 7 to 10 days and keep your spine straight and keep your nervous system healthy, your brain fully connected to the body so that your body can heal well. But I'm not an expert in these other things, but I can give you a couple quick tips. Eat well. If it's not food, don't eat it. Don't put any chemicals in your body through your mouth or through your arm, as in vaccinations, if they're not food. If those chemicals aren't good for you, don't put them in your body. So read your labels before you get a vaccination, read the ingredients. And before you put any food in your mouth, read the ingredients. If you can't pronounce them, don't eat them. Move well. How many minutes a day does the research say that you need to exercise in order to stay healthy? Just 15 minutes a day. You can do it through walking, yoga, it doesn't matter. Whatever you can find yourself doing every day, once a day for 15 minutes. Think well. Wherever your mind goes, your body follows. You know a Nancy negative in your life? How healthy is Nancy? Not too healthy. But how about Patty positive? If you know a Patty positive, you know she's staying pretty healthy. So how do you get positive? Well, at night, pick up a salt and pepper book at your dollar store, one of those composition books, and at night, before you go to sleep, write 3 things you're most grateful for. The first night will be very, very generic things. I have a roof over my head, I have food in my stomach, I have clothing on my back. Those are the last 3 things I want you to think of before you go to sleep. When does the body heal itself? Well, it's when you're sleeping. So I want you to begin to write 3 things that you're grateful for every night. At first they'll be benign, but eventually they'll be profound. You may even write more than 3 things, and that's okay. But I want you to do those 3 things, write those 3 things down before you go to sleep so that you can keep your body healthy. Now remember, you can't eat a healthy meal and say, I had such a good meal, I never need to eat again ever. You can't have a great workout, walk or yoga or stretching and say, I never need to do that ever again, that was so great. Just like you can't have one adjustment and say, that was a great adjustment, I never need to do that again, I'll never have stress again in my whole life. All these things need to be done regularly, and they need to be done at the same time together if you want to really maintain perfect health. So, if I've told you the truth so far and told you all the science, who should have their spine checked? Well, anybody who has a spine should have it checked. My whole family was adjusted. My daughter was adjusted when she was 45 minutes old. My son was adjusted when he was 10 minutes old, right on the warming table. Anybody with a spine should have it checked. Should everybody who comes into my office that gets checked be adjusted? Absolutely not. If you come into the adjustment room and I put you on the table, check your spine, and there's no subluxations, I will give you a star at the front desk, we'll put it on your card, and that visit is absolutely free. There's no charge for that visit. It's my pleasure to check you, but I only charge when you're subluxated. My mission in my office is to detect and correct subluxations in a fun, safe, and caring environment, and to restore and maintain your health and your family's health and your friends' health and everybody in my community until every last person in my community is checked and adjusted when necessary. How do you help me fulfill my mission? Well, RYF. Run, you fool. No, it doesn't mean run, you fool. It means refer your friends and family. I used to use a star because the star means you had a perfect checkup, but not everybody understood that. So I changed it to a lifesaver. All I ask is that you throw your friends a lifesaver. Tell them about chiropractic, but don't lie to them anymore. Don't tell them you should go to my chiropractor because you'll feel better, because now you know that there's nothing I can do for their pain. I can only detect and correct their subluxations. Instead, very simply, you can show your friends, just with your hands, the truth about chiropractic. You can tell them, hey, maybe you should go to my chiropractor, because all the bones in your spine should line up perfectly. If a bone goes out of alignment, it actually pinches the nerve on the other side. Wherever that nerve goes to doesn't function properly. All my chiropractor will do is put the bone back in line, take the pressure off the nerve, so the brain can fully communicate with those cells, and the body will heal better. Now, did I say feel better? No, we can't promise that. But when we take the pressure off the nerve, the body immediately begins to heal better. And that's what I would like you to share with your friends. You're now part of the informed minority. I want you to go ahead and tell the uninformed majority. 23 years ago, I was called by my receptionist. Her son had taken a fall, and on the way to the hospital, he was having a seizure, and he died. On the way to the hospital, they revived him, and they brought him back to life. This was in Lawrenceburg, Indiana, where I used to practice for 10 years near Cincinnati. When they got him to the hospital, they could not stabilize him, so they air flighted him from our local Dearborn County Hospital to Children's Hospital in Cincinnati, where he died 2 more times, and they brought him back to life twice more. But when they got him to the hospital, he was in a coma. She asked me to come check him, and I said no. He was in a great children's hospital, and I told her they're going to run every 3-letter test in the book. They'll run an EEG, EMG, MRI, CAT scan. They'll find out what's wrong. But I said, Mary, if they don't find out what's wrong, call me back and I'll come up to the hospital. The next day, 24 hours later, at 5 o'clock at night, she calls me and said, they ran all those tests. They don't know what's wrong. Please, can you come up and check him? He's still in the coma. At that point, he had been in the coma about 35 hours. I made a phone call to a good friend in Georgia, who was the president and founder of the International Chiropractic Pediatric Association, Larry Webster. And he told me that I needed to get to that hospital and check that child's atlas, the first bone in his neck, because it was probably causing pressure on the base of his brain, called cord compression. Put the bone back into place, and then be prepared for the 2 things that might happen. The first is when we take the pressure off that nerve, the brain will fully communicate with the body, and the body will recognize that it's healthy enough and you might wake up. But when we take the pressure off that brainstem, and the brain, if the body's too sick, the brain will also recognize the body's sick and he might graduate. But you should definitely go up there and check him. That scared me. So I made a second call to one of my professors in Davenport, Iowa. It was an hour earlier there. And he told me almost verbatim the same thing. I drove to the hospital. I went into the hospital, up into the ICU, where I found Stephen laying in a bed, a 24-hour nurse, and his mother, Mary, sitting there. Mary said to the nurse, could you please leave the room? This is my brother. We're going to pray. The nurse left. She asked me to check Stephen's neck, and sure enough, I found that first bone in his neck sitting out of its normal alignment. I told her the 2 things that could possibly happen that I was told by both my professor and my friend down in Atlanta. And I asked her if she really wanted me to check and adjust him. She told me that she knew why she brought me up and she wanted me to fix the bone. I reached over and I couldn't get to the right side of the bed, and his neck was out of line on the right side. I reached over and I put a little bit of pressure on the first bone in his neck. When I did that, we heard a little noise when the bone moved back into place, but it was loud enough to where Mary could hear it over the breathing apparatus. He'd been in the coma for 36 hours at that point. And after I adjusted that bone, guess what happened? Nothing. No thing. Nothing happened. He didn't even stir. No alarms went off, no the monitors changed, nothing. Mary's face got long. She went to the phone to call her husband, Rodney, because they had 5 kids, to tell him what happened. I was holding Stephen, by the waist. There was nothing more that I can do. About 45 seconds passed. She had got on the phone with Rodney, and she said, "Rodney, Corson's here, but." And as she said "but," Stephen's eyes got wide, and he started fighting the respirator. There was nothing I can do to help him. Every alarm went off. Negative airway pressure, CO levels, oxygen levels, respiration, pulse, all the alarms went off. 2 nurses come charging in, push me out of the way. They move the bed over so there's room on both sides now. Mary drops the phone on the floor. She runs to the bed. The lead neurologist in the hospital comes running into the room. Now he's at the head of the bed telling Stephen, calm down, let the machine breathe for you. Stephen's just a 10-year-old kid. He's wide awake. He's not letting the machine breathe for them, and they realize that. So they take off the ventilator, they take out the respirator, and he begins to breathe on his own. They shut off the alarms, and the room begins to get quiet. I hear next to my foot the phone. She had dropped the phone. I reach down and pick up the phone, and it's Rodney, and I said, Rodney, get the kids together, come up to Children's Hospital. They're still in Indiana. Stephen's awake. I put the phone back on the wall. I look over at the bed, and Stephen picks his head up off the bed, looks straight at me and says, "I'm thirsty, can I have a drink of water?" I said, "Stephen, my life was just changed. You can have whatever you want, kiddo." That night, I became a chiropractor. Not the year and a half before that I was popping and cracking people's backs to do exactly what you thought you wanted me to do, to take away your pain. I thought that's how you make money in chiropractic. That night I learned that chiropractic is not about feeling good or feeling bad. It is about life and health. It is about restoring the connection between your brain and every one of those 70 trillion cells in your body. If you think that I got Stephen out of that coma, you're wrong. All I did was remove the pressure from the nerve. It took him weeks and months to rehabilitate, to gain all of his fine motor skills back. The body begins to heal itself when the interference is removed, and that's the only thing that I did. So, I know you wanted to sit there and listen to me for the rest of the evening or afternoon, but the class is over. And I want to let you know that if you have any questions, don't hesitate to ask me in the office. Once you've seen this video and I do a thermal scan and check your spine, it'll only take me about 2 to 3 minutes to check your spine, to check you from your head all the way down to your sacrum. Check the whole spine. It doesn't take long to be adjusted. The busiest time in our office is on Saturdays. That's when all the families come in. So if you come in on Saturday, prepare to wait a little bit. It's not a big deal, but just bring something with you for the wait. Typically our wait in our office is only about 10 to 15 minutes. After you make your appointment for your first visit, either at this class or after you watch this video to come in for the first time, you'll never need an appointment in our office again. We're walk-in only. Grab one of our cards. It has our hours on the back, and just come right on in. Make sure we have your email address so that we can email you any times that we're not going to be here, and to give you our newsletter every month to let you know what's happening in the office. If you have any questions, don't hesitate to ask. I look forward to seeing you in the office to remove your subluxations, to restore the communication between your brain and all 70 trillion cells so that you can once again start healing again. Thank you.